And we talked about the appropriate weight gain during the first trimester. What nutrients and behaviors are more important in the first trimester continued? So the need for nutrient increase for certain nutrients increase, obviously. So from the moment of conception, the pregnant woman needs certain vitamins and minerals in higher quantities. Most needs can easily be met with a diet, but some nutrients require special attention. So folate or folic acid, we need about 400 micrograms per day before conception and then continue thereafter. Iron, supplement needed for red blood cells, anemia prevention, fetal development. So, one of the unfortunate side effects to iron supplementation is constipation. However, the pros vastly outweigh the cons. And then we need additional zinc and copper, which are key to baby cell growth. And then finally, we need to be sure that we're getting enough calcium and vitamin D to preserve the bone mass that we have. Other nutrients are also a concern, especially for those who eat no animal products, so vegans and vegetarians. We want to make sure that we're able to get our omega-3 fat, our DHA, our docosahexaenoic acid in seafood for the brain and the retina. We want to be sure we're able to get choline for healthy cell division, especially in the brain. And then we want to consume vitamin B12, and if we eat animal products, it's not an issue, for nerve cells, red blood cells, and production of nucleic acid. Now, too much preformed vitamin A can be toxic. It can increase the risk for birth defects. So if we're looking at a vitamin supplement, we want to be sure that it limits our supplements to no more than 3,000 IUs per day, especially for vitamin A. Now here's the nutrient needs during pregnancy based on the MyPlate. Here's intake. We've got not quite doubling of protein. We have to up our carbohydrate minimum a little. We actually get to 600 micrograms of folate. We have just a little bit increase of thiamine, riboflavin, a little bit of niacin, a little bit of vitamin B6, B12, vitamin C, a little bit higher on vitamin E, not much higher on our vitamin A, so 70 micrograms. Our vitamin D more or less stays the same, calcium stays the same, magnesium goes up just a skosh, copper goes up, iron goes up, phosphorus stays the same, and zinc goes up. So ultimately, we're not really necessarily under the, for the first trimester, we're not trying to increase our weight. So this is still based on a 2,000 to 2,200 calorie diet. But as pregnancy progresses, you add 340 calories per day for the second trimester and then 450 calories per day in the third trimester. So that MyPlate even accounts for the anticipated weight gain during the second and the third trimester of pregnancy. So pregnancy actually increases the risk for foodborne illnesses, and I talked about that during the last chapter. Like, I was way anal about consuming preserved meats. So Listeria monocytogenes, it can easily cause miscarriage, premature labor, low birth weight, developmental problems, and even infant death. So I avoided raw and undercooked meat, fish, or poultry. I didn't consume any unpasteurized milk, cheese, juices, raw sprouts. I avoided sandwich meat, deli meat, luncheon meat, all that kind of stuff. Pregnant women should also avoid many other substances, so obviously nicotine, alcohol, and illicit drugs. That puts you at risk for SIDS, for FASDS, for birth defects. I mean, it's just not worth the chance. What was so funny is as my pregnancies progress, like my oldest is 6 years old. They didn't necessarily ask me about illicit drug use. They just asked me if I was a smoker or a drinker in my OB-GYN's office. As I went from my twins in, let's see, they were 14, and then my last one, which was in 2016, as time progressed, they started asking me if I was an active user of illicit drugs, like that wasn't just a little blank spot on the sheet of paper. Someone was looking at me and asking me. And I just remember thinking, gosh, that's so sad that people have to ask that for pregnant people. Um, and then also you want to restrict caffeine intake to 200 milligrams or less. Again, take care when you're consuming fish. We talked about bioaccumulation in the foodborne illness chapter, and then again, we know that there's certain fishes that we have to watch out for being contaminated with methylmercury, which is a neurotoxin. So the importance of critical periods. Okay, every developmental period, it's all really important, but there's critical periods. So developmental stages in the first trimester when cells and tissue rapidly grow and differentiate to form structure, to form body structures. So not only are they getting their instructions from DNA, they're getting instructions from other proteins that say, hey, you're going to be an eye cell, you're going to be a brain cell, you're going to be a nose cell. So during these critical periods, the embryo and the early developing fetus are highly vulnerable to nutritional deficiencies, toxins, and other harmful factors. And really, during this critical period, the risk of miscarriage is greatest, whether it's from a abnormal number of chromosomes to a nutritional deficiency, or maybe a Okay, so at some point this quit recording. So, pregnant women need to consume adequate calories, so carbohydrate and protein to support growth. You should consume about 340 calories more in your second trimester than before pregnancy and gain about 1 pound a week for your second and your third trimester, depending on what your body mass index was ahead of time. You need about 175 grams of carbohydrates per day more compared to 130 grams for non-pregnant women. And your protein needs increase by 35% to about 71 grams per day during both the second and the third trimester. So here's an example of how we could account for an additional 340 total calories. We could consume 1 whole wheat English muffin, 2 tablespoons of peanut butter, and 5 baby carrots along with it. Now, I apologize, I had to go back. For some reason, the mic turned off on me. So exercise is important for pregnant women and non-pregnant women alike. It's important for first, second, or third trimester. You should get at least 150 minutes of moderate intensity aerobic activity per week and plan on spreading that over 7 days. So some of the benefits include improves weight gain within targeted ranges. So it helps keep you on weight gain track, if you will. It can decrease aches and pains. So if anybody's been pregnant, especially with twins like I was, you know that there's aches and pains to the nth level. So your back pain, your feet, your sciatica. It can lessen constipation. It can improve energy level. It can reduce stress. It can also improve your sleep and lower your risk of gestational diabetes. Now, when we talk about exercise, we have to think about safe and unsafe. And ultimately, you need to seek the approval of your healthcare provider. But safe activities would be something like walking, stationary cycling, low impact aerobics, swimming, and dancing. Unsafe activities, which would be contact sports or high impact activities, you could look at hockey, both field and ice, basketball, football, soccer, gymnastic, horseback riding, skating, skiing, whether it's snow or water, vigorous racket sports, and weightlifting. So those are all examples of activities that you might want to scale back when you are pregnant. Now, potential complications that may pop up in the second trimester. You've got gestational diabetes and hypertension. So gestational diabetes is usually transient. It's confined just to gestation, and it's diabetes that occurs in women during pregnancy. Okay, what are the results? It can result in macrosomia, which is a large baby, and a large baby is, by today's standards, weighing more than 8 pounds, 13 ounces. It increases the risk of baby having jaundice, having breathing problems, and birth defects. So gestational diabetes is something that healthcare providers want to identify and manage as soon as possible. Pregnancy-induced hypertension includes kind of like 3 levels. Gestational hypertension, so it's high blood pressure develops about halfway through pregnancy. That can go into preeclampsia, which includes hypertension and protein in the urine, which is a sign of kidney damage. The treatment usually includes for preeclampsia bed rest, some medication, even hospitalization until the baby can be safely delivered. And if untreated, it leads to eclampsia, which eclampsia can cause seizures in the mother and is a major cause of death of women during pregnancy. So gestational diabetes and hypertension is something that healthcare providers absolutely want to know about and be able to manage. Now, in the third trimester, women should be taking in an extra 450 calories per day and still gaining about 1 pound per week, depending on what their pre-baby BMI was. The growing baby puts pressure on the stomach and the intestines, so they feel full a lot, so sometimes they have to work to eat. Hormones slow food down through the GI tract and can also enhance or promote constipation. Heartburn and constipation may result. And then the best way to combat that is small, frequent meals and avoid spicy foods can help heartburn. So after the twins, probably after I got about second trimester with the twins, I was pretty much eating like a bird, just like eat a little here, eat a little there. And if it was anywhere near spicy or hot, I did not eat it. It was not worth the heartache I was going to feel from the heartburn. And then increasing fiber rich foods can actually help manage the constipation. Now, with constipation and that pressure in the GI tract, hemorrhoids may also develop. Now, when you think about younger or older mothers to be, so pregnant teenagers face special challenges because they're still growing themselves and they're likely to have very unbalanced diets. So they may be short on iron, folic acid, calcium, and calories, all because they're not eating properly themselves. So they're actually at higher risk for pregnancy-induced hypertension, premature and low birth weight babies. Now, women older than 35 are more likely to develop diabetes and hypertension. So, they need to achieve a healthy weight prior to conception, avoid smoking, eat balanced diet, and consume adequate folic acid.